Incremental innovations in wet lab and surgical training during COVID-19 pandemic. COVID-19 have consumed the world. As the waves of corona pandemic engulfed everything and everyone, the world was forced to shut down. Lockdowns were announced and everything came to a standstill. The travel restrictions implemented made it nearly impossible for patients to come to hospital for routine examinations and non-emergency services. The fall in the patient rate affected both the clinical and surgical skill development of resident trainees. To ensure the flow of medical and surgical training to go smoothly without compromising on the safety during pandemic, we have developed some incremental innovations. We developed a makeshift simulation environment well isolated from the regular patient flow area. The new wet lab was arranged in such a way that good ventilation was maintained, social distancing was followed, and at the same time surgical procedures like small incision cataract surgeries, phacoemulsification, and penetrating keratoplasty could be performed with the help of spring-assisted fixation of eyeball. 3D printed model eye research can be used for practicing indirect ophthalmoscopy, slit lamp examination with 90D lens, and basic steps of vitreoretinal surgery. Research helps develop hand-eye coordination and orientation to wide-angle viewing system. Research with PETG film is excellent for endolaser practice. Goat's eye were integrated with cataractus lens obtained from small incision cataract surgery were used for practicing phacoemulsification. But the decrease in cataract surgeries during COVID-19 pandemic affected this. So we thought of some artificial nuclei that resemble human nucleus in the form of soap pellet. Soap is a salt of fatty acid which is produced by saponification of fats. Goat's eye packed with cotton gauze is loaded in the mannequin head. Superior tunnel of 8 mm was made at 12 o'clock position. Anterior chamber entry with keratome was made. At 9 o'clock position, clear corneal entry. Staining of the anterior capsule by tryphan blue followed by injection of the viscoelastic. 6 o'clock position, side port was made. Depending upon the comfort of the trainee, capsulorhexis of 5.5 mm can be done either through the side port or the clear corneal entry. Phacoemulsification of the central nucleus was done, forming a crater. Soap pellet of 7.5 mm diameter was made using tryphin. Soap pellet was placed through the 12 o'clock position tunnel and sutured. Side port was made at 11 o'clock position and nucleus was trenched initially by cracking and emulsified subsequently. Surgical video recording with traditional microscope mounted cameras offer a good alternative to teach the surgical techniques through video recordings and reviewing with seniors. However, live monitoring and guiding throughout the surgery is a challenge. GoPro is a compact action camera mainly used by sportsmen and people involved in extreme action. With a dedicated app for both Android and iPhone, the GoPro camera can pair perfectly with any mobile device to access the variety of features. With inbuilt Bluetooth and Wi-Fi, the users can go live. GoPro has inbuilt speaker through which the user can give voice over to what is getting captured in the camera. This video recording system has turned out to be extremely useful during COVID times. We have mounted GoPro camera to the side scope of the surgical microscope, which is paired with the tablet through the GoPro app. Learning from the experts. When an expert surgeon is operating, the surgery can be live streamed as in Facebook or YouTube, which can be watched by the junior surgeons through their smartphones or laptops easily at their own place. Since GoPro comes with an inbuilt microphone, the operating surgeon can give live commentary of the steps being performed.
The rexis should be performed under high molecular weight visco.
This will greatly benefit a larger group of students. Guidance from the seniors. When the junior surgeon is operating, the live video streaming can be used to get guidance from the trainer or any senior surgeon. The junior surgeon can present their problem through the GoPro microphone and the trainer can keep adding comments in the comment box, which can be conveyed to the operating surgeon by the assistant. Even though a telephonic conversation can also be used to get the guidance from the trainer, the discussion can negatively disturb the patient who is getting operated. Telementoring. Once the initial training is complete and the trainee has started performing surgical technique independently, monitoring of the surgery by the mentor stops at that stage. Mentor reviewing the trainee's surgical performance after a certain number of independent cases can greatly increase the trainee's efficiency. Many a times, the mentor may be staying far from the trainee's place and frequent travel to guide may not be practical. GoPro recording system can help in telementoring either during live streaming or reviewing the surgical videos at a later time. GoPro surgical recording is a less expensive alternative to the traditional surgical video recording system. With its unique features, it can help us overcome the challenges of continuing surgical training during COVID-19 pandemic, thereby giving life to surgical training. These incremental innovations keep the resident trainees on track and updated themselves with their clinical and surgical skills even in these tough times, and must be taken forward even after we have overcome this pandemic, because commitment is what transforms into reality.